Here's the upper.
Yeah, that.
Middle.
Yeah. Feels better.
Yeah, good. There it is.
Hey, yo.
So your hip is the biggest issue, correct?
Yeah.
It's the right side?
Yeah.
Can you show me where do you usually feel the pain at in terms of the hip area? So it's right into the back area.
And it penetrates into the buttocks.
Down into that glute area?
Mm-hmm.
Okay. And so it starts from here, kind of goes down into the glute.
Mm-hmm.
Does it go down into the leg at all?
It used to.
Okay, but it just
Right
kind
now
of
it's
sticks to
not.
here.
Mm-hmm.
Okay. Now, anything
It's
on the
off
left
and
side?
on. Just have to say that.
Okay.
Off and on. Sometimes it does and sometimes it doesn't.
Down into the leg? Okay, but this is pretty regular. Okay. Anything into the left side?
No.
Nothing. Okay, so this is the area that you're feeling it, the pain that goes down into the glute. Anything in the mid back and then the neck?
Yeah. A lot of warm in between here. And then pain on this shoulder and then sometimes on this.
Down onto the left side. Okay.
And of course on the neck pressure.
Okay, we got some stuff going on. This has been going on for how long in the lower back?
Years.
Okay. Do you remember anything that occurred that started the process?
Yeah, my daughter was, when I was delivering her, the epidural, when they injected it, they pinched the nerve and put this whole leg to sleep, and it was out for hours.
Right, okay. The feeling eventually came back?
Yeah.
Okay, but that's kind of where you felt
hours
like
later.
Okay, so up here, they're pretty normal. These are, it's not too tense, not too crazy back here. But back here, you can see these muscles are really trying to guard your lower back right here, especially this left side. It seems like it's really it's much more bulkier. And sometimes it can happen where we might have an issue on one side and then it compensates and shifts to the left side here as well. Definitely looking at your upper back here, we can definitely see, you said your right side's a bit more problematic. Yeah, the left side's a little bit less. This is much more tense on this side here. Which makes sense looking at your x-rays, because here, right in that mid-back is where it kind of pivots, and then your spine leans over to that left side. But then your neck continues outside, so these muscles are trying to hold onto your neck, trying to pull you back over to the center. And let's go and scan your spine. Let's do some measurements here, see how things are looking. Yeah, so we actually do have some pressure right into the neck right there. It's around your C6, C7 area. Yeah, it's pretty consistent too. That's how we know it's a true reading here, is because I can scan through that and you're gonna see that reading pop up every single time. Yeah, right there. That's the spot right there. Okay. Yeah. So definitely in your x-rays, as we look at that, you can see it kind of tilts here and then it shifts over, but you're seeing a huge reading right there. So that's what we're gonna take a look at and see. So we might have to address your neck and your mid-back here today. Okay, so we definitely got some pressure on that right side. Okay, so I'm gonna push into some spots in your spine. If there's any pain, soreness, or tenderness, you let me know right away, okay? So the first one we're gonna check out is that lower back. We're gonna take a look and see where we're at. So I'm gonna check out the good hip, or the better hip, I should say. Sore there?
Yeah, right.
Okay, you
right
got some
there.
soreness on the left. Yeah, sometimes when we have an issue, you can have hypermobility because one side's stuck. And because that side is stuck, it's going to cause the other side to overwork. So here's that upper joint, middle, and then the lower.
A little bit right there.
More on the bottom one there, a little bit lower here. And again, I'm going to take a look at the upper side here. Here's the upper.
Yeah, that.
Middle.
Yeah.
And one more. And then the lower. Not as much there.
No.
So it seems like this is on the upper here and this one's down on the bottom one. Now as I bring you over to the side here, bring you back. That's sore right there?
Yeah.
Okay. And then this side?
Yeah.
Okay. But right there, that's where you're feeling that. Okay. 1, 2, 3, 4, 5, 6. We have 6, we have 7, and we have 8. 6, 7, 8. Any pain there?
Yeah.
Which is the worst? 6, 7, 8.
8.
8's a little bit more tender there. I'm going to tilt you over to the right. Here's 7, 8, 7 right there. Okay.
Yeah.
That's where you feel that tenderness on the 8. Okay. Yeah, I think we're going to stick with the 8 here. Okay, so we're going to go ahead and do that. We're going to do C7. We're going to do your T8. I think 1, 2, 3, 4, 5, 6, 7. We said 8?
Yeah.
Okay. And then we got your right side. Okay, we got some work to do. You ready?
Yes.
Alright, so we're going to see if I can bring this thing back into position here. Now, I'm going to bring you right over here. I'm gonna bring that chin up just a hair. Perfect. I'm gonna bring it down just a little bit more here. All right, so you might hear a little bit of a popping noise, okay? It's just the gases in the joint, nothing too crazy. So we're gonna bring you over to the side. Let it go. There you go. There it is. Oof. So I want to take a look at the movement on that joint and see how that's feeling, okay? And that really took some work to get some movement in there. Okay, that's moving much better. All right, so this joint, what it's done is it's gone down and it's pulling back out this way. We're gonna push that back into position here. There you go, right there's perfect. I'm gonna roll you just a little bit here, okay? So right on over here. There you go, relaxing that shoulder. Good. All right, coming up, you're gonna walk to the wall and you're gonna walk back over to the chairs. There you can start from here. And then walk back over to the wall, right over to that side. Good.
I feel something like pulling, huh?
A little bit of pulling? Yeah, come on over. When you say pulling, what is it? What do you mean?
Like unusual feeling.
Uh-huh.
Not the normal that I feel.
Yeah.
So.
Let's get you walk a little bit more. Yeah, a lot of times when we start shifting some things, the muscles, they're not used to that position.
Right.
So patients will say, oh, wow, like something's different, right? And the pulling is actually a good thing because those muscles are starting to engage. All right.
It feels better.
Yeah, good. Let's get you one more. We're going to get you on this table over here. If you don't mind, actually. Come on back. Right there. And one more time. Breathing in. And just let the shoulders relax. That's what I'm looking for. Okay.
You can definitely feel a difference. I don't feel the heat anymore.
In that mid-back?
Heat, yeah.
Okay.
Like the heat.
Good.
It's basic walking, but it feels different.
Yeah. Well, and that's what we're going to do is basically as we start to shift and move some things, we're going to try to retrain your body here. Okay, so come on over. So we did 3 things for you, right? So we did the first one was your pelvis. Yeah. What it's done is it's shifted down and it's dropping out. We're trying to push that thing back into position, but because it's been this way for such some time, basically your body's having to retrain itself. Now with your neck, even your mid-back was really tough in there as well, right in this area. Because it's been there for such a long time, sometimes it can take some work to get those joints to loosen up, which is why it took us a couple times in your neck here, okay? Once we kind of get that scar tissue, it kind of heals in the improper position, so we're trying to break through some of that stuff to allow that to set in the proper position. Because of that, you can't feel a little soreness with the adjustments just because it's been that way for such a long time. Your body's trying to undo some of that. So it's like when you go to the gym, you start exercising, you're like, oh, it's kind of sore. The same thing can happen to your body with the joints here. Your body's got to go through the healing process now, okay? But you've lost that curve. The discs already have a lot of arthritis in there, a lot of degeneration. So it's been there for years, but we have to work on trying to get that to get back into position here, okay? So we did your neck, we did that mid-back where it kind of shifts over to the left, trying to bring you back into the center. And then the lower back, we did this one here just because that joint's become inflamed there. You did a good job.
Thank you.
So proud of you.
It.
Yeah, I'm excited for you.
Looking forward to being able to walk straight.
Yeah.
And painless.
Yeah. So
thank you so much.
All right, my pleasure.